One of the questions that we get a lot at Fairbanks Urology is, what are kidney stones made out of? Well, there are several types of kidney stones. 80% of them are made up of calcium and oxalate, so calcium oxalate. Another smaller percentage is made up of uric acid stones, and those are probably 15–20%. Very small minority are made up of cystine stones. Those are more rare stones, and there are also infection kidney stones. So kidney stones that are really the product of there being an infection in the urine and some of the metabolic byproducts of the bacteria in the urine will precipitate the production of kidney stones. The next question that we often get is, how do we make sure that kidney stones don't come back? So how to avoid kidney stones? There are a lot of different things that we can help with, and those are really sort of dependent on each individual. So the type of stones that you make, and also the type of urine that you have in your urinary system, those are very important factors in helping you prevent kidney stones from coming back. So the way to understand how to prevent the recurrence of kidney stones for any one specific individual is really through doing a 24-hour metabolic evaluation, where we give you a bucket that you urinate in for 24 hours, and we analyze the chemical composition of that urine. And from that, we can determine in you what would be the most effective way of preventing the recurrence of kidney stones. It's really not just the composition of that one kidney stone, but also the composition of the urine is really, really important. By and large, there are two major ways of preventing kidney stones. The first one is drink a lot of water, because even if you might have some imbalances in the metabolic composition of your urine, if you dilute the urine to a certain extent, it will definitely help with prevention of kidney stones. So always drink more water. That helps enormously. Another thing that is a little bit less known, and people are always surprised when I discuss this with them, is salt. So although they might have calcium kidney stones, salt is a really important determinant of, a factor in producing kidney stones, because when we eat a lot of salt, that salt needs to leave the body at some point, and really leaves the body through the kidneys. So when the kidneys are excreting the salt, calcium gets also dragged in there. So one of the most important factors in increasing calcium in the urine is actually the amount of salt in the urine. So it's not really an intuitive thing, but some people try to eliminate calcium. Well, there's a lot of trials that have shown that actually a super low calcium intake actually does not help at all. If anything, it increases the kidney stone composition, because if there's too little calcium intake through the diet, then other chemical imbalances happen, such as too much oxalate in the urine, and that can precipitate, ironically enough, calcium oxalate stones. So water and salt are two important things. Yeah, that's good. All right, cool.
One thing is, can you check your